Good morning, I'm Dr. Dangleben. This is the medical education tidbit from Patient Choice in Chemin, Neuf, Pointe. Michel will continue with these educational pieces as best as we can. What do I want to talk about today? And I want to talk a little bit about ACE inhibitors because someone did mention the chronic cough, and that was a good point. That goes along with ACE inhibitors, right? Enalapril, captopril, lisinopril, right? All of these medications fall under the class ACE inhibitors, all right? Angiotensin converting enzyme is what ACE stands for. That's more for very scientific. We're not going to get into that, but it's a high blood pressure medication. It's good for heart failure, okay, and also in patients with diabetic kidney disease. So it's effective, but there are noticeable side effects, right? And most commonly is the chronic cough. You do get a chronic cough when on ACE, and it's a very high percentage of patients. So we talk about maybe 1/4, 25% of the patients tend to have that. And it's because of some underlying substances called bradykinin and substance P, which is really above this conversation, but it builds up and can irritate the airway, right? And that's why you have that persistent dry cough that will resolve if you stop the medication. The one I really want to talk about is what's called angioedema, and people use scare tactics to with pictures and things like that. But if you want an ACE inhibitor, right, captopril, enalapril, lisinopril, you need to be aware of that. It's a very low chance of that happening, but you don't want to be that person, and you want to be cognizant of it. It's 0.05 to 0.1, okay? So that's maybe what, 1 in 1,000, 1 in 10,000, something like that. My math is not mathing, but it's a more serious than the chronic cough. It has life-threatening implications because what happens is your entire face, your lips, your tongue, and throat swells up. And if that happens, you could block your airway, and obviously, no airway, no life. So it's very, very important because the problem with the ACE inhibitor angioedema is, typically if you have an allergic reaction, it's what's called histamine mediated, meaning that you can give antihistamines, you can give steroids, but with the ACE inhibitor angioedema, it does not respond well to antihistamines and steroids. So you have to be aware of that. Okay, so again, once these side effects occur, you want to stop the ACE inhibitor. All right. There's a new medication, relatively new medication called ARB, right? Valsartan type medications. They're called angiotensin receptor blockers, and that's an alternative. It has a similar cardiovascular benefits, and it doesn't have the same risk of the cough and the angioedema. So if you're taking an ACE inhibitor and you see some swelling, don't stick around. Go to the emergency room. Okay? The chronic cough is just what it is, a dry cough. But if it's bothersome to you, talk to your provider and then discuss changing the medication. I will talk about, next conversation, I will talk about the different types of high blood pressure medication. Okay? And hopefully someday soon we will have a pharmacy so we could fulfill prescriptions at Patient Choice. We have to continue to help community, help people, and that's what we're about. Have a great day. Peace.